Hi, I'm Emilija, and I'm the Vice President of O Warrior. I want to thank all of you so much for joining us on the virtual 5K today. If you aren't familiar with O Warrior, we are a nonprofit that supports families throughout their omphalocele diagnosis, and there are a number of different ways that we do this. We support families with resources that range anywhere from monthly support groups, wherever you are on your journey, to grants when you're in the NICU or receiving closure surgery or facing any other medical bills. We provide educational materials to families directly, as well as to hospitals to distribute to families at the point of diagnosis, either at ultrasound or when they are referred to an MFM. We have a car seat program where we get the specialized car seats that these O babies need to the families. We either purchase them new directly, or we pass them on from a family that has graduated from the car seat and donated them to us. And we're always looking for more ways to be involved with families and in your communities, so feel free to reach out to us on socials if you have any ideas on ways that we can get involved or any needs or support that you need. We would love to hear from you, and we appreciate you so much for being a part of our first annual virtual 5K. Thank you again so much for being a part of it, and we are glad to have you here.
Hi, I'm Ben.
I'm Beverly, and this is Beckett Lord. So we found out when I was 16 weeks pregnant that Beckett had a giant omphalocele containing his liver and intestines. And we were overwhelmed. We had never heard of the term omphalocele or knew anything about it. We found O Warrior online, and all the stories and information really helped us not feel as alone. Um, so his my pregnancy with him progressed normally until I had my C-section at 37 weeks and 1 day, and then Beckett was in the NICU for 2 weeks.
And then at about that time, his omphalocele ruptured, and he had to have an emergency surgery for skin closure. He was in the NICU after that for about another 6 weeks. We were able at the Winnie Palmer NICU in Orlando, Florida. We were able to stay in the room with him while he was at the lower intensity NICU for about the last month of his NICU stay. And then finally, we were able to come home after about a total of 2 months in the NICU. And after coming home, he had a pretty intensive OT for feeding therapy, and he was discharged from the NICU with a feeding tube still. And so we were working on getting the tube out and getting him eating on his own. And then we were able to get into an intensive feeding program at Palmer Hospital that lasted for about 3 months, and it was 4 days a week. And finally, after that experience, I think it was 2 months into the program, we were able to get his feeding tube out, and since then he's been doing very well and eating independently.
And as you can see, he's still a handful.
Just to give you a little bit introduction of who I am originally from Brazil and moved here when I was 8 years old. And have been here in the States. We live in Charlotte, but I trained in Stony Brook in New York as a pediatrician, and then at Duke University in Durham for my fellowship, where I got the opportunity to treat several patients with both just small omphalocele as well as very large giant omphalocele. I have twin girls, and they were NICU babies as well. It was a very urgent emergent delivery due to some complications, and they were in the NICU for a very short amount of time, but it has drastically changed the way that I practice and the way that I communicate with families, because I got a very small idea of what it is to walk into a NICU and walk out without your kids, and have to do that day after day, and get disappointed about, hey, we're going home, and hey, we're not going home. And it was a very difficult experience, but I am so grateful that I have that and I am able to share that with my patients. I will also say this is a topic that's very dear to my heart. And I had the privilege of treating Grace, as well as the little one, Dimitrik. And it's still emotional for me. And so please excuse me if I break into tears. But it is something that has really touched my heart and changed who I am as a physician. So I always like to start, any prenatal consult that I'm doing with families in addressing the fact that the minute you found out your baby has a diagnosis, and that's whether it is omphalocele or a congenital heart, or a defect of any form, that a sort of mourning process begins. Because it is a mourning process in terms of the idea of the pregnancy you imagined, or the idea of the birth plan you had, or whatever that might be. And it's something that continues throughout your pregnancy. So it's always very hard. And I think as physicians, we have to be very aware when we're talking to families, because it is very difficult. To us, it might be something that we see more often than we would like, but in reality, it's your whole world. And so I always challenge my coworkers to talk with grace and with patience, because it is a lot. And it's, instead of having a pregnancy that's filled with, celebrating everything, that gets dulled a little, because you're worried every single second. What does this mean? What is it going to look like? When are we going to go home? Especially with omphalocele, it's recognizing that though some babies might not need a surgical intervention, others will. And then knowing, especially with the giant omphalocele, dependent on what organs are in there, there's huge risks associated, and usually long-term stays. So it is a very complex thing. So I just want to acknowledge that right now, that I know every single one of you, whether you are pregnant right now or you have delivered an O baby, that I see you, and I know that this is very difficult. So please have some grace upon yourselves. It is okay to ask doctors the same questions over and over and over again. A lot of the information we share with you guys is trauma-based information, right? And so you are only grasping about 20% of what we're saying. And in order for you to become an advocate for your baby, you have to understand that language. And in the NICU, we say it's almost like we're speaking a foreign language. There's so many new words, so many new medications. And I think the biggest challenge we face too, is kind of once you enter the NICU world, each unit is set up a little different. But one of the hardest things, and I know I asked Cassie and TJ to share their experience in terms of what were the challenges that they faced, and also as a physician that I see, and that is that every week, some places every 3 days, some places every 24 hours, there's a different physician on. And because omphalocele can be treated so differently, that plan can seem so inconsistent. And I want to recognize in saying that it becomes really difficult sometimes to trust the team you have, because it changes so much. And you start asking, who do I trust? Is it this person? Is it this provider? And so again, ask those questions. At the end of the day, it may not seem like right now. At the end of the day, you know your baby best. You have felt them inside of you for as long as you carry them. You know the signs, you know their smile, you know when it's a good day and when it's a bad day. And don't forget that through your journey, because it's easy to forget in the sense that when they're born and it's scary, you're looking to the providers to be that parental role in essence and say, this is what we're going to do for baby A, B, and C. because a lot of, families don't have any medical background. And so somewhat it feels like, yes, I just had a baby, but I am trusting these individuals who I've never seen or never heard to do all the major decisions for my kid. And so I challenge you guys that even through that, that you guys still know your baby best. And I am a big proponent that there is a God-given sense that you get as a mom, as a dad, as a family member of when something's wrong. And it may not be clinical. I may not see any signs like a heart rate change or blood pressures or things we look at, but there's this feeling that you get. And I can't tell you how many times I've had parents say, Danny, I don't know what it is, but I feel it. Can you please just check the hemoglobin, or can you please just check something? And they were right. So please never forget through this journey, you are your baby's best advocate and you know them best, irregardless of what it might feel like. So I always like to prepare families that it can be very scary. And I challenge them to always tour a NICU before you actually have the baby. There are lots of monitors. Depending on the layout of your actual NICU, you might have an individual room, which is really nice, which will allow you to actually spend time with baby and give you privacy. And then there are units like ours here in Charlotte that you do not have individual rooms, unfortunately. And so you are mixed with other babies. And so you have a 22-week infant right next to your full-term baby with a giant omphalocele. You have a baby who's critically ill next to a baby that's stable. And that can be really challenging for parents, but it can also be a really good place to build community. And so that does not take away from the fact that walking in and seeing the monitors or seeing your kid maybe intubated on a ventilator and with the beeping sounds and then the IVs and all that stuff is really overwhelming. So I always challenge parents to, if possible, if your hospital offers a tour, please take a tour, get to know the layout so that it is less of a kind of shock when it comes to walking in, and when it's your kid is a very different feeling. With giant omphalocele or omphalocele in general, there's a huge spectrum. So I've seen very small ones where the omphalocele is actually, it almost looks like it's contained within the umbilical vessel. And then I've seen very, very giant ones that have stomach and liver and intestines. That the giant omphalocele, I'm going to be honest, is always a big challenge, just because of the sheer size of space that one usually has to heal before we can kind of send kids home, but also the risk of, because it's an enclosed state, of something getting trapped. And so again, it's us being very, very watchful and mindful, and sometimes getting a lot of images and watching for subtle signs that there's something going on. And usually we worry more about that when we start, let's say, feeding and things like that. It's where we really got to watch closely. I have seen babies, again, depending on the size, who have been with us for a couple of weeks to many, many months. And, unfortunately and fortunately, because we get to build that community with you guys as well. But it is a huge stressor on families, both financially, emotionally, physically. And so the other tidbit I will give you guys is that if your hospital, if there's any way they can help, whether that is by putting you in a hospitality house or the Ronald McDonald House, or offering vouchers for gasoline or whatever it is, irregardless of what path you come or your financial situation, take the help, because it is something that I never want my parents to worry about, is how am I going to come visit my kid, or how am I going to do this, because you already have so much on the table. So if there's any way that we can unburden that, please ask for resources and accept them because they're there to help out. So don't shy away from that. When the other things I always tell parents is I am someone who's going to be very transparent, and that has been, it's really hard. And so I always ask parents to have some grace on us as well, because it is very hard to share some of these very scary diagnoses, some of these very scary long-term fears that we have. And in a lot of my experiences, it's very personal because we've gotten to know you, we've gotten to know your baby. And it's also painful for us to share that information. But I am a firm believer that in order for you to advocate for your baby, you need to have all the information to make the best decision possible. And that looks different for every single family. And that's what I stress. Some families face a lot of odds in terms of challenges that the omphalocele brings to the baby or concerns we have. And, you know, they can decide to say, yes, we want to move ahead and we want to do everything possible. And for some families, that looks like, I just don't want my baby to suffer. My goal is to take them home and have them have the best life possible. And so again, when you're thinking about the life you imagine for your baby, that's always something important to keep in mind. And so physicians should never shy away from those conversations. And if you feel like if you feel like there's something that they're not telling you, then call it out, name it out, and say, hey, I just feel like there's something that's very unclear, or hey, I just feel like, is there something that you would like to share with me, even if it's difficult? And challenge them to kind of step up to the plate. It's not always easy, but you have every right to know, so that you can make the best decision for your child. So there are layers of complication when it comes to omphalocele because they are associated with so many not GI related abnormalities, such as heart or bladder, or even other intestinal issues. And so the care should always be individualized to your baby. That is a pet peeve of mine when I see other physicians saying, oh, but most babies do A, B, and C. Right, but that's not my baby. And so always challenging them to look, yes, the care is A, B, or C for 99,000 babies. But what about my baby? And challenge them to kind of personalize that care. And that is where, again, there is an art to medicine. Everyone's going to manage it a little bit different. But the point is that we always want to support families, not only in their decisions, but walk them through them, so that it is clear. And if there's something unclear, again, I challenge you to just ask those questions and keep asking them. The other thing too is doctors, I say, are also like therapists or like marriage. There is a good fit for everyone. And so if sometimes it can't be helped, right? It's just the rotation of the doctors and stuff like that. But if there is a physician that you feel is it's just not connecting, and that's okay, right? Just like every relationship is not going to end up in marriage, or a therapist is just not going to be the right fit. Sometimes it just takes speaking out and asking to talk with someone and say, it's not that I don't like that doctor or trust that doctor, or whatever it is. It's just, I don't think it's a good fit for me and my family. And that's okay. And most units are able to kind of accommodate and try to help out in bringing that communication. And a huge part of that is that if your hospital offers is actually they call it the palliative team or the PAC team. I like to refer to them the quality of life, because that is truly what they're about. It's about looking at the challenges of very complex kids and saying, how can I have them have the best life possible, whether that be 3 days or it be, 18 years when they age out of the pediatric age. And so, if your hospital has a pediatric palliative care team or a quality of life team, they oftentimes become a not barrier, but become kind of a middle person between you guys and the physicians or the nurse practitioners. Because I also acknowledge that sometimes it can be hard to talk to the medical team. They also are able to give a lot of guidance of what life looks like outside the NICU, because they follow those kids through the birth and the whole process with the healing and the surgeries and all that, into, if let's say they go to a step down unit or the pediatric floor, or you get readmitted, you will see that same team through. And they are great about saying, hey, yes, I know this baby. I had them from birth. These are the complications they had, or these are the things they like. And so if they offer that, please use them as a resource. The other thing is also, some units have unit psychologist, which is also really, really helpful. Just trust me on this. If they have availability for that, please take advantage of it. It is stressful already to be in the NICU, much less with a baby with a complex congenital defect. And having someone to talk to who understands and is trained to talk to families is crucial. So please take advantage of that. And again, the last thing I'll say is always ask for clarity on things. Because like I mentioned, physicians can change, people can change, the nurse practitioners, you get so many faces. Please ask for clarity and say, the other doctor mentioned this and this. What are your thoughts? Because sometimes we just need to get all on the same page. Some units will offer one physician for very complicated patients, where that physician is kind of the point person. So even if you may see a different attending on, that is your doctor. And so it kind of becomes, again, another person that's able to say, no, this is the plan we made with the family. And so what can we do to continue and be consistent with that? Yeah, those are kind of the major things I talk with families. Again, I'm here to answer all and any questions. I know I didn't get into the details or the care of omphalocele and stuff like that. I think most of you have read. Oh, please, for the love of God, avoid Googling things. Google is great, but I assure you, I have died many times on Google for my illnesses. They usually show the very extremes of range. And so the pictures you will see are very, very scary. The stories you will hear are very, very scary. This is a great organization, a great group to get really good informative information, but also be weary of groups that on Facebook or Reddit and things like that, because some of that information might not be accurate, or again, might not be accurate for your baby. And so, yes, it's important to be in the know in research, but please ask your physicians or your maternal fetal doctors, where can I go for the best resource? And hopefully they'll be able to point you in the right direction.
My name is April. I'm almost 49. I'm in Kamloops, British Columbia. That's 4 hours north of Vancouver. So I'll just kind of read. I might leave or add some things out. So I'm the oldest of 7 children. My parents live and lived in the sticks. So I'm in Kamloops and they live 2 hours away. And my mom had a really easy pregnancy with me. They weren't sure of her due date. So the town next to my parents is Clearwater, which is very, very small. And so the next one would have been Kamloops, this city here. And they had just got an ultrasound machine, a still ultrasound, wasn't even a moving one. My mom just told me that yesterday. And my doctor's like, well, my mom's doctor, he's like, well, why don't you go in and get they just got this brand new ultrasound, go in and get your dates checked. So she comes in and basically that's what they found out happened, is that I had this omphalocele. And then, so of course they didn't know essentially how much, but they did say I had a full abdominal omphalocele. All my organs were affected from the bottom of my liver to the top of my large intestine. The peritoneal sac was intact at the time in utero, but during birth, it did burst. So they were unable to have my mom deliver. So my mom's doctors suggested that, well, he didn't suggest, he said you will have to fly down to Vancouver. And at the time there was, anyway, it was just easier to fly. So they also were told there was a doctor there that had the best survival, a surgeon there that had the best survival rate for babies that were from like west of Toronto Hospital. So he was like one of the best surgeons. So my mom flew down. I was born in Vancouver General Hospital. There was no children's hospital there at the time. Mom chose to have me vaginally. They asked if she wanted a cesarean and she opted out. And that's probably why the sac burst. Mom said I cried right away. And they put like this Teflon bag. I say it's kind of like a bag of oranges or bag of avocados over my stomach. And they twist tied it with like a medical grade twist tie. She was only able to touch me, was able to hold me. Or so she was finally at Christmas. She was able to hold me and give me their first bath. But for the first 6 months, like I was born in June 76. So for the first 6 months, mom couldn't even hold me. I was immediately put on a ventilator. My lungs were also plastic, so they weren't inhaling. This is basically what kept me in the hospital. I don't want to scare anybody, for 21 months. If it had just been my omphalocele, I probably would have been home in about 6 to 8 months. But I had a lot of heart breathing issues. So like I said, it just kept me from coming home for 2 years. But that's just my story. Obviously everybody, I hear a lot about babies. Oh, they're home in 4 months and 6 months, and that's fabulous. It's not to scare you. So I was kept on my back the majority of the time. I had many cardiac arrests because of my heart-lung issues. They say I had probably 12, maybe even more cardiac arrests, which kept my brain from, which we know now, probably caused a bit of brain injury. I'm trying to, that's where it is. So at about the time, it was 8 hours. Vancouver was 8 hours from where my parents live. And so mom would come down about once a month to visit me in the hospital. For the first 6 months, mom says I was fed intravenously. And then after that, from like a year to 20 months, I was fed via NG tube. And then once I got a hold of food, I just couldn't stop. So there you go. And what else? So as far as my parents were encouraged, so I was the oldest. So my parents were just encouraged to go home and live their life as a married couple and just not say they don't worry, but don't spend all their time, worrying about me and being with me. That's a whole other attachment issue that I have. Obviously they say different things now. They would call a couple times a week to see how I was doing. They actually were discouraged, especially in the beginning, to not take any pictures of me. And but they only have they've taken lots of pictures. I have lots. And then what else? So then when I got home, so I got home when I was 2 or 20 months old. My mom was actually pregnant with my brother at the time. And so here she is, this 23-year-old mom with this medically fragile baby in the sticks and pregnant, probably sick. So she was taught by the RT respiratory therapist to suction me. And I actually remember being suctioned and like, let's say beating, that's not the word, but she would put me on her knee and she would like pat my back. I actually quite liked it to get all the air, all the fluid out. I didn't crawl, I just scooted. When I was 2, I had my tracheostomy closed in. When I was 4, I had my big surgery. Mom thought it would be 3 or 4. Still done at the general hospital because there was no children's hospital that built then. I remember that too. And they basically used Teflon to just put everything in. And I do have a gnarly scar, but is what it is. And they probably could do a way better job now. But again, it was in the 70s or 80s now. Life for me now is I did get sick. So most of my teen years, I did pretty well. I had a couple lips. When I was 31, I got really sick, hypoventilation, which basically meant I couldn't breathe at nighttime. And I found out later that 30% of, now I don't know if it's true, if it's just what I remembered, 30% of omphalocele people can have this, which is you just don't breathe at nighttime because your stomach is all like, it's just all, it doesn't have those muscles to breathe. So I have a BiPAP machine and it's made my life like way better. I could have had children probably, but life happened and I did get married, but there's lots of things happened and we didn't have kids. It probably would have been a difficult pregnancy, but I probably could have done it. So yeah, partly like when I was little, you wouldn't know it now, but when I was younger, I actually did a little bit of track in my elementary years and bit of soccer. So I did play a little bit of sports. Yeah, I was pretty active when I was a kid. We lived on a farm, so lived on a ranch. So after I was about, 5, 6, I was able to do everything, that everybody else could do. So yeah, that's the short version. I would just say, and I think everyone's doing it, ask lots of questions. Family members of God, get all your family members involved, which Corinne sounds like you're doing awesome. Yeah, be there, obviously be there, but you can, but yeah, you do need a night away. You don't, again, the longer the baby's in, you'll need that time away, right? So it is important to have that time away as a couple or as a family. Get the kids involved, but don't burden them if you have younger or even older kids. If they can help with things like, padding and suctioning, it's easy to put them on your lap and just, my mom would just put a towel on my back so it wouldn't hurt as much. And get them involved and get them aware. Like even now, all my siblings are very aware. Obviously, when they were younger, they were very aware of what I had. Even when I was when we were all kids. Yeah, don't rush the baby coming home, but be on them as well. Like I remember mom kept saying, okay, well, you said that this certain time we could take her off the ventilator, and they finally did. And you just have to be on them. As we know, you still have to be advocates for your own family and for your own health. And of course, this is what I just realized yesterday. Like if you can, obviously there was no Facebook back then. But if you can get them involved with or around other kids with O kids, if you can get them around other kids with who have O's or families, do that. I felt very isolated. I don't think I've ever met anybody with an omphalocele ever. So this is why I wanted to come on too, to see other people that have survived it.
Me.
So yeah, I know. I want to get to know you too, Susan. I know. So that's the quick version. I didn't want to go too long, so I will let Susan talk now. So
I was born on Friday the 13th in October in New York. Hospitals didn't have any technology at that time, so doctors didn't know if anything was wrong until the mother gave birth. Our doctor, Benjamin Pollitt, explained to my dad that since I was full term and came out screaming, he thought he should give it a shot. Left alone, I would die anyway, so they had a 50-50 chance. In the 40s, 50s, and 60s, they really tried to save babies with severe birth defects. I had what they then termed a huge O with everything in it. My dad told them to try. They stabilized me, had me baptized, and then given the last rites. While that was going on, a few family members went across the street to the funeral home to set up my funeral. And at 2 hours old, they pushed everything back in and sewed me up. There were no NICUs or PICUs in those days. It wasn't until sometime in the mid-60s that you had NICUs and PICUs. I was in a covered bassinet in the nurse's office. They had an NG tube in to feed me, but there were no other needles or tubes for babies. They had to just wing it and go on the fly. I vomited up lots of blood the first few days, and they transfused me by using syringes filled with blood going right into my veins. Dr. Pollitt said when he went in the day after I was born, one of the nurses was coming out of the office and said, "She's still here." He felt that I might actually make it. I was in the hospital for about 2.5 months. My parents were allowed to visit, but could only stand or sit in the hallway and look at me. They weren't allowed to come near me or touch me. When I was released, they pulled the NG tube out and just handed me to my mom, who then had trouble getting me to feed. I had a hernia repair at age 2.5 years old. And the summer before I started kindergarten, my mom asked about muscles. Up until then, I had something called a truss holding my stomach in. So that summer, they stretched my back muscles to the front, and that was my muscle closure. Needless to say, I don't have anything like a strong core or back muscle. I was fine till about age 12. From then until I was 28, I had seven serious bouts of blockages and adhesions, which landed me in the hospitals with operations. They also found out from GI tests and bariums that my body wasn't breaking down fiber, and in my late 20s, they put me on a low residue diet. They also found out that I had very slow digestion, which affected my eating and weight gain. Life calmed down after that. I got married in 81. I had my son in 1986. He was born on Valentine's Day. He's my Valentine baby. And I saw a high-risk doctor, but it went like a normal pregnancy. My organs are malrotated. Some are fused together. My heart's on the right, which is called dextrocardia, and it's tilted towards and more into my back. My right kidney is small and in a very weird place, basically right next to my heart. But it's working. My left kidney is not in the proper place either, but the doctor said it's in the ballpark. I have 80% lung capacity and a duplicate inferior vena cava. The usual growing up, didn't really eat much, always very thin. That was until I hit menopause. Now, of course, I'm overweight. Dr. Pollitt was my doctor until age 10. We then moved to Long Island. In my early 20s, when I went to visit some relatives, I stopped into his office. I asked the secretary not to give my name. I would introduce myself. I went into his office and said, "Hi, Doc. I don't know if you will remember me." He stopped me mid-sentence and said, "Oh, Susan, how could I ever forget you?" I visited him several times after that, and that's how I learned most of my medical history. My parents wouldn't talk about it. I have since found out I have a very mild case of pulmonary hypertension, which isn't bothering me, and a slight case of scoliosis. Also very long, skinny lungs, which is the cause of my breathing issues. Most of my issues now are more age-related than O-related, though I still have bouts of constipation, but just drink more water and cut back on eating. However, last year I did have a partial blockage, and I'm getting over now a partial blockage I had 2 weeks ago. I would like to acknowledge my mother's side of the family and my dad. In the 1950s, while the birth was covered, operations on newborns weren't. You had to be several months old before medical would cover it. The hospital wouldn't release me until the bill was paid. No charity or religious entity would help them. My mom's, really verklempt with this because it's really good. My mom's 8 siblings and her mother handed over what savings they had to pay the bill. My dad worked 3 jobs for 12 years to pay everyone back, not to mention pay our rent, buy us a house, put food on the table. There were some rough times, but we all helped one another and we made it through. Because of the because of the moose site and the adult O site, there are about 15 either adult O's or pregnant moms with O's or old children, which luckily I have met almost all of them in the last several years. We used to have lunches up until COVID, that kind of stopped it. But that was really good to actually find like my tribe, that we had, that there are other people out there, because for 60 some odd years, I thought I was the only one out there. Also because of better technology now, similar to April, when I would go to sleep at night, I would wake up sometimes having a lot of trouble breathing and thinking I was going to pass out, and would scare the bejeebers out of my parents and even my husband a few times. And I got sick several years ago. And while I was in the hospital, they did a lot of research, which is how they found out I had such long, skinny lungs. And that when I slept, my oxygen levels went down, sometimes in the low 70s and sometimes actually hit the high 60s, which is not good. If you put a pulse ox on me, my oxygen levels usually would be in the low to mid 80s just during the day on a good day. But since they discovered that, now I use a machine at night. I have an Inogen portable on my nightstand, and I use the oxygen, which really has helped me during the day as well. Now, if you put a pulse ox on me, the levels actually read 90 or 91, which is, my doctor was like, whoop, whoop, that's so good for you. And it does help me walking. And I have a portable one in case we go on, 5 or 6 mile hikes. At least if I feel like I'm getting a little congested, I can just whip that out and put the oxygen in, and has a little, it's like a cross pocketbook bag type thing. And it just gets me through the day, which with all the modern technologies now, they're finally doing all the things that, babies today are having, which are helping me, at least in my old age here, since I'll be 75 in October. I can't believe it, but here I'm still here. But that's my story, and I hope it helps somebody.